Narcissistic Personality Disorder, (NPD), represents one of the most fascinating yet misunderstood conditions in modern psychiatry, characterized by a pervasive pattern of grandiosity, need for admiration, and lack of empathy. This complex personality disorder affects approximately 1% of the general population, though prevalence estimates vary due to diagnostic challenges and the reluctance of many affected individuals to seek treatment. Despite increasing public awareness of the term narcissism, significant misconceptions persist about the clinical disorder, which involves far more than mere self-centeredness or vanity. At its core, NPD features a dramatically inflated sense of self-importance that permeates virtually all aspects of an individual's life. Those with the disorder typically believe they are special or unique, deserving of special treatment, and entitled to admiration regardless of actual accomplishments. This grandiose self-image, however, often masks a profoundly fragile sense of self-worth that requires constant external validation. The contradiction between outward presentation and internal experience creates a psychological vulnerability that drives many of the disorder's most problematic behaviors. The interpersonal dynamics of individuals with NPD revolve around obtaining admiration and validation from others. Relationships frequently serve primarily as sources of narcissistic supply, the attention, praise, and special treatment that temporarily bolster their fragile self-esteem. This instrumental approach to relationships manifests as a notable lack of empathy, with difficulty recognizing or identifying with the feelings and needs of others. The person with NPD may appear charming and engaging initially, but struggle to maintain genuine reciprocal relationships over time as their self-focus and exploitation become apparent. The emotional landscape of someone with NPD involves remarkable sensitivity to criticism or perceived slights, often responding with rage, contempt, or emotional withdrawal when their grandiose self-image is threatened. This narcissistic injury triggers defensive reactions aimed at restoring their sense of superiority and protecting the vulnerable self beneath the grandiose facade. The intense emotional reactions appear disproportionate to outside observers, but reflect the existential threat that criticism poses to the narcissistic individual's psychological organization. Research into the etiology of NPD suggests a complex interplay of biological, psychological, and social factors. Twin studies indicate moderate heritability for narcissistic traits, suggesting genetic factors contribute to vulnerability. Neurobiological research has identified differences in brain regions associated with empathy, self-reflection, and emotional regulation, though whether these differences cause narcissistic traits or result from them remains unclear. From a psychological perspective, developmental theories propose that NPD may arise from either excessive admiration without realistic feedback or, conversely, from emotional neglect or inconsistent parenting during critical developmental periods. The psychodynamic understanding of narcissism, pioneered by Heinz Kohut and Otto Kernberg, provides valuable insights into the disorder's underlying structure. Kohut described narcissistic individuals as suffering from developmental arrests in the formation of a cohesive self, resulting in persistent needs for mirroring and idealization. Kernberg emphasized the defensive function of grandiosity, viewing it as protection against primitive rage and envy. Both theorists recognized that beneath the arrogant exterior lies profound insecurity and vulnerability, a perspective supported by contemporary research showing high rates of comorbid depression and anxiety in this population. Diagnosing NPD requires careful clinical assessment, as many features overlap with other personality disorders and may be temporarily present during certain life phases or in response to specific contexts. According to diagnostic criteria, an individual must demonstrate a pervasive pattern of grandiosity, need for admiration, and lack of empathy beginning by early adulthood. Specific symptoms include grandiose self-importance, preoccupation with fantasies of unlimited success or ideal love, belief in being special and only associating with similarly special people, requiring excessive admiration, sense of entitlement, interpersonal exploitation, lack of empathy, envy of others or belief others envy them, and arrogant behaviors or attitudes. Clinicians recognize several subtypes of NPD that present with different behavioral patterns. The grandiose/overt subtype aligns most closely with the popular conception of narcissism, displaying obvious arrogance, entitlement, and exhibitionism. The vulnerable/covert subtype presents more subtly, with hypersensitivity, defensive self-effacement, and shame that masks underlying grandiose fantasies. The high-functioning/exhibitionistic subtype may achieve genuine success while requiring constant admiration, while the malignant subtype combines narcissistic features with paranoia and antisocial tendencies, potentially manifesting as vindictiveness when their entitlement is frustrated. Treatment of NPD presents significant challenges for mental health professionals. Individuals with this disorder rarely seek help specifically for their narcissistic traits, more commonly entering treatment due to related problems such as depression, relationship difficulties, or substance abuse. When they do engage in therapy, building a therapeutic alliance proves difficult due to their entitlement, sensitivity to perceived criticism, and tendency to idealize then devalue their therapist. Limited insight into their own contribution to problems and minimal motivation to change interpersonal patterns further complicate therapeutic progress. Psychodynamic approaches to treating NPD focus on gradually building self-awareness and exploring the origins of the grandiose self. These therapies aim to help the individual develop a more integrated and realistic self-image while processing the shame and vulnerability that fuel defensive grandiosity. Transference-focused psychotherapy utilizes the therapeutic relationship as a vehicle for examining problematic interpersonal patterns and their emotional underpinnings. Mentalization-based treatment focuses on enhancing the capacity to understand mental states in self and others, addressing the empathy deficits central to the disorder. Cognitive behavioral approaches to NPD concentrate on modifying maladaptive thought patterns and behaviors. Schema therapy addresses early maladaptive schemas and coping styles that underlie narcissistic traits, such as entitlement, unrelenting standards, and emotional deprivation. Dialectical behavior therapy skills can help manage the intense emotional reactions and interpersonal conflicts common in NPD. These structured approaches provide concrete strategies for regulating emotions and improving interpersonal effectiveness, though they must be adapted to accommodate narcissistic resistance to perceived criticism. Group therapy offers unique benefits for individuals with NPD by providing immediate feedback about interpersonal behaviors and challenging grandiosity in a way individual therapy cannot. However, careful screening and group composition are essential, as these individuals may dominate discussions, seek excessive attention, or withdraw when not receiving special treatment. When effective, group settings provide valuable opportunities to practice empathy, receive authentic feedback, and recognize the impact of their behavior on others in a supportive environment. Pharmacotherapy plays a limited role in treating NPD, as no medications specifically address the core pathology of the disorder. However, certain medications may help manage associated symptoms or comorbid conditions. Antidepressants sometimes prove beneficial for accompanying depression or anxiety. Mood stabilizers or atypical antipsychotics may help in cases with significant emotional dysregulation or paranoid features. As with other personality disorders, medication should generally complement rather than replace appropriate psychotherapy. The impact of NPD extends beyond the affected individual to their families, workplaces, and communities. Spouses and children of individuals with narcissistic traits often experience emotional neglect, criticism, and manipulation, sometimes developing significant psychological distress as a result. In workplace settings, narcissistic leaders may create toxic environments characterized by exploitation, blame shifting, and devaluation of colleagues who challenge their authority. Understanding the interpersonal dynamics of narcissism can help families and organizations establish appropriate boundaries and expectations. The prognosis for NPD varies considerably among individuals. While the disorder has traditionally been viewed as highly resistant to change, emerging research suggests that narcissistic traits may decrease naturally with age for some individuals, particularly the more external manifestations of grandiosity and entitlement. Treatment outcomes improve when interventions address the underlying vulnerability and shame rather than directly confronting grandiosity, which typically provokes defensive reactions. Motivation for change often increases when the costs of narcissistic patterns, such as relationship failures or career setbacks, become apparent. Recent research has expanded our understanding of NPD and continues to refine assessment and treatment approaches. Dimensional models of personality pathology, as reflected in alternative diagnostic frameworks, may better capture the heterogeneity observed in narcissistic presentations. Neuroimaging studies are elucidating the brain mechanisms underlying empathy deficits and emotional dysregulation in NPD. Early intervention programs targeting vulnerable self-esteem and interpersonal skills in adolescents show promise for preventing the crystallization of narcissistic traits into the more rigid patterns of the personality disorder. In conclusion, narcissistic personality disorder represents a complex condition characterized by grandiosity, need for admiration, and empathy deficits that significantly impact functioning across multiple domains of life. While treatment challenges remain substantial, our evolving understanding of the disorder's underlying psychological structure has led to more nuanced and effective intervention approaches. With appropriate therapeutic support and sufficient motivation, individuals with narcissistic traits can develop greater self-awareness, more authentic relationships, and a more stable sense of self-worth that doesn't depend on constant external validation.